The night Sergeant First Class Denton Krauss arrived at Riverside Behavioral Health, he came in the way most combat veterans do, quietly and all at once. He wasn't brought in by family. There was no family left to call. The paramedics had found him sitting on the floor of his apartment in Fayetteville, back against the wall, knees up, both hands gripped around the collar of a Belgian Malinois that weighed nearly 90 pounds. The dog's name was Cipher. The intake report said Krauss had not spoken a single word during the 40-minute transport. He'd just held on. The triage nurse who processed him at 2:14 a.m. noted his vitals, noted the dog, and flagged the situation for the overnight supervisor. The supervisor made a decision that seemed, on paper, entirely reasonable. Animals were not permitted in the behavioral health unit. There were policies. There were liability considerations. There was a ward full of other patients whose needs also mattered. Cipher would have to go to the facility's secure kennel. Krauss heard that, and something in his face went very still. He didn't argue. He didn't explain. He just looked at the supervisor the way men look when they've already calculated every possible outcome of a situation and decided that none of them are good. Then he sat back down in his chair and put both hands on Cipher's back and did not move. By 6 in the morning, 3 staff members had attempted to separate them. None had succeeded. That was the situation Joelle Marsh walked into when she came on shift. Joelle was 31 years old and had been a psychiatric nurse for 4 years, which meant she was old enough to know when a situation had been mishandled and young enough to still feel something sharp and uncomfortable about it. She'd done her first 2 years at a county hospital in Charlotte, then transferred to Riverside because the unit director had promised her something about meaningful work, which she'd half believed because she'd wanted to. She'd grown up the daughter of a man who came back from Fallujah in 2005 and never really came all the way home, and she'd gone into psychiatric nursing the way people sometimes go into things, not because it was planned, but because something in her had recognized a need and moved toward it before she'd even thought it through. She read the incident log at the nurse's station before she went to find him. Retired? No. Active retirement, technically involuntary medical separation. 2 deployments to Afghanistan, 1 to Iraq. Traumatic brain injury, 2019. PTSD diagnosis, formal, 2021. Cipher was not a pet. Cipher was a trained PTSD service animal, certified through a nonprofit that worked specifically with combat veterans, and his presence with Krauss was not sentimental. It was medical. The dog was trained to interrupt nightmares, to create physical grounding during flashback episodes, to alert when Krauss's cortisol spiked before he was even consciously aware that something was happening to him. None of this was in the overnight supervisor's notes. Joelle set down the clipboard and walked down the hall. He was in room 4, which was a holding room, not technically a patient room, which meant it had plastic chairs and fluorescent lighting and nothing soft anywhere. Krauss was in the corner chair. Cipher was pressed against his left leg, and Krauss had one hand buried in the fur at the dog's neck, and he was watching the door with the specific attention of a man who had spent a long time in places where watching the door was what kept you alive. Joelle did not go in. She stood in the doorway and she said, "Sergeant Krauss." Not sir, not Mr. Krauss, not the vague, gentle, slightly condescending Denton that she'd watched 2 different staff members try. She said his rank, because his rank was part of who he was, and she'd grown up watching her father flinch every time someone forgot that. He looked at her, not through her, the way he'd apparently been looking through every other person on the overnight shift, at her. She said, "I read your intake documentation. I understand Cipher is a certified service animal under the ADA. I also understand nobody on the overnight team flagged that before making the decision about the kennel." She paused. "That was an error. I'm sorry it happened." He didn't say anything. She didn't push. She had learned, from her father and from 4 years on a psychiatric ward, that sometimes the most important thing you can do is not fill the silence. After almost a full minute, he said, "They're not going to let him stay." "I'm going to find out what our actual policy is," she said. "And if the policy doesn't account for ADA-certified service animals, then the policy is wrong, and somebody needs to know that." Something moved through his face that wasn't quite relief and wasn't quite disbelief. It was the specific expression of a person who has been told the right thing so rarely that they've stopped knowing how to respond to it. "You're a nurse," he said. "Yes. Not administration. No. He looked at Cipher. Cipher was watching Joelle with calm, steady eyes, and his tail moved once, slowly, the way working dogs' tails move when they've decided something is safe. "He's never wrong," Krauss said quietly, "about people." Joelle looked at Cipher for a moment. Then she said, "I'll be back in 20 minutes," and she left to find the unit director. The unit director was Dr. Patricia Wren, and she was the kind of administrator who had once been a very good clinician and had slowly, over the years, become someone who managed risk instead of patients. She wasn't a bad person. She was a tired one, which sometimes amounts to the same thing. Joelle laid out the ADA documentation, the service animal certification papers that were in Krauss's file but had apparently not been read by anyone on the overnight shift, and the specific federal guidelines that governed service animals in healthcare settings. Dr. Wren looked at all of it and said, "The kennel decision was made in good faith based on the information available at the time." "The information was available," Joelle said. "It was in the intake packet, Joelle." Wren's tone shifted into something careful and slightly warning. "I understand you're concerned, but we have a protocol for a reason." "The protocol," Joelle said, keeping her voice very level, "doesn't match federal law. And the patient is currently in a holding room in an acute psychiatric crisis, and his certified medical service animal is sitting next to him because nobody has read the documentation that would allow us to make an appropriate care decision." Wren was quiet for a moment. "I'll review the documentation," she said finally. "I'd like to be there for that conversation." The unit director looked at her for a long moment. "I'll let you know," she said. Joelle went back to room 4. She brought coffee, which was maybe not a clinical intervention, but was the thing she had access to. She set a cup on the floor near Krauss's chair without making a production of it, and she sat down in the chair across from him, not too close, and she said nothing for a while. "You grew up around military," he said eventually. "It wasn't a question." "My dad," she said, "Army. He came back from Fallujah when I was 12. Krauss looked at her. "He doing okay?" The question surprised her. Most people asked about her. This man, in the middle of his own acute crisis, had asked about her father. "Better than he was," she said honestly. "It took a long time." Krauss nodded slowly. "It always takes a long time. Were you in the 82nd? She asked, because she'd seen the patch outline on his bag. He looked at her differently then, not with suspicion exactly, with assessment, like he was recalibrating something. "3rd Brigade, he said. "My dad was 1st Brigade, she said. Different rotation, but he knew some guys from the 3rd. The silence that fell then was different from the earlier silences. It had texture to it. The specific texture of two people who have both been shaped by the same long war, from different sides of it, and have recognized that in each other. Cipher shifted and rested his chin on Krauss's knee, and Krauss's hand moved automatically to the dog's head. "He saved my life," Krauss said quietly, not metaphorically. "3 weeks after I came back from the 2nd deployment. He stopped, started again. I was in a bad place. Cipher woke me up, got in my face, wouldn't let me go back to sleep." He exhaled. "I don't know if you understand what that means." "I think I do," Joelle said. "I've had people tell me he's just a dog," Krauss said. "People in this building, in the last 6 hours, those people are wrong," Joelle said. "And they're also, technically, not in compliance with their employer's legal obligations, which I intend to make clear." He looked at her sharply. "I mean that," she said. "I'm not just saying it." Something in his posture changed, very slightly, almost imperceptibly, the angle of his shoulders, the set of his jaw, like a door that has been locked so long its hinges have stiffened, and something has finally given the right kind of pressure. Dr. Wren did review the documentation. She did it 3 hours after Joelle had asked her to, and she did it only after the facility's legal coordinator, whose name was Ted something, happened to walk through the unit, and Joelle happened to ask him a very specific question about ADA compliance in behavioral health settings that caused him to pull out his phone and start reading with increasing concern. The decision to allow Cipher to remain in Krauss's room was made by noon. It was framed in the paperwork as a clinical accommodation pending further documentation review, which was the kind of language institutions use when they've made the right decision for the wrong reasons or in the wrong order. But the decision itself was correct, and Cipher trotted down the hall to room 12 with his vest on and his ears up and his tail doing the slow, steady arc that meant he was exactly where he was supposed to be. Krauss, walking beside him, said nothing. But when he passed the nurse's station, he stopped, and he looked at Joelle and he said, "Thank you." 2 words, quietly, like they cost something. "You don't have to thank me," she said. "This is what should have happened 7 hours ago." He shook his head slightly. "Not for this," he said. "For," he seemed to consider how to finish that. He settled on "for knowing which questions to ask." She understood what he meant. The next 2 weeks were not easy. Psychiatric hospitalization is never easy, and Denton Krauss was not an easy patient, in the specific way that intelligent, self-sufficient people are not easy patients, because they have spent so long managing their own emergencies that accepting help feels like a kind of defeat, and they will fight it even when they want it. He was resistant to group sessions. He refused 2 different therapy assignments before accepting a third, with a therapist named Dr. Osi, who was a veteran of the Gulf War, and therefore did not need things explained to him that other people needed explained. He slept badly, in the particular fragmented way of people with combat-related PTSD, and Cipher earned his certification about a dozen times over in those 2 weeks, pulling Krauss back from the edge of nightmares, grounding him, pressing the warm weight of his body against Krauss's chest at 3 in the morning until Krauss's breathing slowed. Joelle was not Krauss's primary nurse. His primary nurse was a man named Garrett, steady, competent, careful. But Joelle worked the same unit, and she checked in, and she became, incrementally, one of the few people in the facility whose presence Krauss didn't seem to experience as an intrusion. She didn't try to get him to open up. She'd watched people try to get her father to open up for years, the gentle, persistent pressure of family members who wanted so badly for him to just talk about it, and she had watched it not work and then watched it make things worse. She'd learned something from that. You didn't pull. You made yourself available, and you waited, and you trusted the other person to move at the speed they could move. She ate lunch in the common room sometimes, when her break coincided with his. She brought Cipher water when the bowl ran low. She showed him once a photo of her father that she kept on her phone, not to make a point, just because he'd asked what her dad looked like now, and it was easier to show than to describe. Her father looked, in the photo, like a man who had made his way back from somewhere very far away. Older than his years in certain expressions, but present in a way he hadn't been when she was 12 and couldn't understand why he wouldn't come out of his room. "He got there," Krauss said, looking at the photo. "Eventually," Joelle said. "What helped?" She thought about it honestly. "Time," she said. "And a therapist who'd been in combat, and my mom refusing to give up on him, and—" She paused. "He got a dog, actually. Not a trained service dog, just a rescue mutt from the shelter. But I think the dog helped as much as anything." Krauss looked at Cipher. Cipher looked back at him with the absolute uncomplicated devotion that dogs bring to everything they do. "Yeah," Krauss said quietly. "I know what you mean." The trouble started in the second week. There was a charge nurse on the evening shift named Hollis, and the name fit him, somehow angular and closed, who had been with the facility for 11 years and who had formed, over those 11 years, a set of fixed opinions about what psychiatric care looked like and how it was properly delivered. Hollis was not a cruel man. He was a rigid one, which in healthcare is its own particular kind of danger. He didn't like Cipher. Not personally, Hollis was probably fine with dogs as animals, but professionally. In his view, a dog was an unpredictable element in a controlled environment, and Hollis valued controlled environments. He'd allowed the accommodation because he had been told to, but he filed incident reports every time Cipher moved too close to a hallway door, or took up floor space during a group session, or did any of the dozen ordinary things that dogs do. And he framed each report in language that was technically neutral and practically pointed. On the 9th day, Hollis filed a report stating that Cipher had exhibited aggressive posturing toward another patient. Joelle read that report on the morning of day 10 and felt something cold settle in her chest. She pulled the security footage. Cipher had not exhibited aggressive posturing. Another patient, a woman who was struggling with impulse control and had been moving erratically through the common room, had stumbled and fallen toward Krauss, and Cipher had stepped between them, which was precisely what he was trained to do. He had not growled. He had not snapped. He had put himself between his handler and an incoming physical surprise, and he had done it with the calm efficiency of a very well-trained animal doing exactly what it was trained to do. The incident report described this as aggressive behavior that placed other patients at risk. Joelle sat with the footage for a long moment. She thought about her options. The easiest option was to note her interpretation in the unit log, route it to Dr. Wren, and let administration sort it out. Clean, documented, within the scope of her role. The harder option was what she actually did. She went to Dr. Wren's office and she laid out the footage, the original incident report, and a written rebuttal she'd put together in the staff room during her break, citing the ADA documentation, the Certified Service Animal Guidelines, and the specific training records that detailed exactly what Cipher was trained to do in exactly the scenario that had been described in Hollis's report as aggressive behavior. Dr. Wren read everything. "You're saying the report is inaccurate," she said. "I'm saying the report describes a dog performing its certified function and characterizes it as a safety risk," Joelle said. "And if that characterization is used to remove Cipher from the unit, we will be in violation of federal accommodation requirements, and more importantly, we will be actively harming a patient's treatment." Dr. Wren looked at the footage again. "Hollis has been here 11 years, she said. "Yes," Joelle said. "And the footage is the footage." There was a long silence. Dr. Wren said, "I'll need to bring this to the medical director." "I understand," Joelle said. "I'd like my rebuttal included in the review, Joelle." The unit director's voice was careful. "You understand that this kind of thing, pushing back on a senior colleague's documentation—" "I understand," Joelle said. "I'm asking anyway." The medical director was a man named Dr. Anand Subramaniam, who was quiet and precise and had the specific quality of someone who made careful decisions and then stood behind them, which was rarer than it should have been. He reviewed the footage and the documentation and the incident report and Joelle's rebuttal, and then he asked Hollis to walk him through his account. Hollis walked him through it, confidently, with the assurance of 11 years. Dr. Subramaniam watched the footage again while Hollis was speaking. When Hollis finished, Dr. Subramaniam said, "The documentation will be revised to accurately reflect what the footage shows." He said it in the tone of a man closing a door. "I'd also like to schedule a unit-wide training on ADA compliance for service animals in behavioral health settings within the next 30 days. He looked at Joelle when he said the last part. She kept her face neutral, but something in her chest released. Hollis was not fired. He was not formally disciplined, at least not in any way Joelle was told about. He continued to work the evening shift. He was, if anything, more careful around Joelle after that, which was its own kind of outcome. What changed was the unit. The training happened. All staff required attendance, and it turned out that the facility's existing policies on service animals had 3 separate areas of non-compliance with federal guidelines that nobody had noticed because nobody had ever looked carefully enough. Those areas were corrected. The intake documentation process was revised to flag service animal certifications at the point of first contact, before any accommodation decisions were made. A laminated card went up at the nurse's station listing ADA rights for patients with service animals, which was the kind of thing that should have been there for years. Small things, procedural things, the kind of changes that don't make headlines and don't feel like victories when you're tired and you've had a long shift and you're eating a sandwich in the break room at midnight. But they were changes that would be there for the next patient, and the one after that. Joelle thought about that sometimes, sitting at the nurse's station at 3 in the morning, the ward quiet around her. She'd gone into this work because of her father, because she'd been 12 years old watching him disappear into himself and not understood why nobody could reach him, and then she'd grown up and understood it better, and it had made her angry in a useful way, the kind of anger that makes you want to fix things instead of just feeling bad about them. She didn't know if she was fixing things exactly. She thought maybe she was just making sure the systems were less broken, in small increments, one policy revision at a time. That was a smaller thing than she'd maybe imagined when she was 22 and new, but she'd come to believe it was a real thing, and real things mattered. On the day Krauss was discharged, 21 days after admission, the protocol required a care conference with the treatment team, a follow-up plan, documentation, a list of community resources. Joelle was not part of the official care conference. She was not his primary nurse. She had no formal role in his discharge. She was at the nurse's station when he came out. He had Cipher on his left side, leash in hand, and the dog was wearing his service vest, and Krauss was wearing civilian clothes for the first time in 3 weeks, a gray Henley, worn jeans, and he looked tired in the way people look when they've done hard work, not in the way they look when hard work has been done to them. He stopped at the nurse's station. "Marsh," he said. She looked up. He set something on the counter, a folded piece of paper. "For your father," he said, "if he ever wants it. It's the contact information for the program I got Cipher through. They have a wait list, but it's worth the wait." She looked at the paper and then at him. "He's doing okay," she said. "People can do okay and still need something," Krauss said simply. She picked up the paper. "Thank you," she said. He shook his head slightly. The same gesture as before, the one that meant this is the wrong direction for the thanks to be going. "The night I came in," he said, "I'd made up my mind about something." He didn't specify what the something was. He didn't need to. "And then you came on shift and you said my name. The right way. And I needed about 30 seconds to decide not to act on what I'd decided." He looked at Cipher. "Him and you, that's what I had that night." Joelle held very still. "I'd know that," she said. "No," he agreed. "I know you didn't." He picked up his bag. "I have an outpatient appointment Thursday," he said, "and one the Thursday after that. And Dr. Osi's office is 20 minutes from where I'm staying." He said it like a list, like he was reading off coordinates. "That sounds like a good plan," she said. "I think so too." He adjusted the bag strap. "Take care of yourself, Marsh. You too, Krauss." Cipher turned his head and looked at her one more time, that same steady, amber-eyed look from the first morning, and then the two of them walked down the hall and through the double doors and out. 3 months later, a card arrived at the unit addressed to the nurses' station. The envelope had a Fayetteville postmark and no return name, just initials. DK. Inside was a photograph. Krauss and Cipher, outside somewhere, looked like a park. Afternoon light, a lot of open space. Krauss was sitting on the ground with his back against a tree, and Cipher was sprawled half across his lap, tongue out, completely ridiculous, in the way large dogs are ridiculous when they're comfortable and they know it. Krauss was smiling. It was a small smile, the careful kind, the kind that has to be rebuilt from nothing. But it was real. Joelle had been doing this long enough to know the difference. She pinned the photograph to the corkboard above the nurse's station, between a reminder about flu shot documentation and a printout of the revised service animal policy. She thought about her father. She thought about the dog she'd grown up with, the one they'd had to put down when she was 17. And how her father had cried at the vet, and it had been the first time she'd seen him cry about anything, and how she'd understood then that the dog had been carrying something her father couldn't carry alone. She thought about 30 seconds. 30 seconds between a decision made in the dark and a different morning. She didn't think about it the way people think about close calls. She thought about it the way she'd learned to think about most things in this work. As a reminder that small things were never actually small, that the right words spoken at the right moment could be the difference between a door open and a door closed, and that the people who were the most alone were usually the most careful about who they allowed to matter. It was a hard job. It would always be a hard job. She had known that when she chose it, and she knew it more completely now, the way you know things after years of them rather than just the idea of them. But some nights, sitting at the nurse's station at 2 a.m. while the ward slept around her and the city was quiet outside, and somewhere in Fayetteville a man and his dog were sleeping through the night without the nightmares winning, she thought, this is the work. This is exactly what the work is. And she was grateful, in the deep, tired, particular way of someone who has found the thing they were meant for, even when it costs them, even when it's hard, even in the long hours of the night when nobody's watching and nobody's keeping score. She was exactly where she needed to be.